Shalom, welcome to the Jewish View. My name is Rabbi Nachman Simon with the Chabad House of Delmar, and today we have a very special guest with us, Dr. Michael Fuhrman. Welcome to the Jewish View, Mike.
Thank you, nice to be here.
So you have your own practice, First Care, right in you could say, the center of Delmar.
Four corners, yep.
Four Corners, excellent. But now we're actually going to talk to you a little bit about another position you have at Conifer Park, and tell us about it.
Right, well, for the last 10 years or so, maybe more, I've been working at Conifer Park as a physician seeing opiate addicts in hospital, as well as outpatient, 5 days a week. I'm there Monday through Friday as an inpatient, and Tuesday, Wednesday, Thursday in Troy, outpatients.
When you say inpatients, that means they're in beds?
Yeah,
That's what it means?
basically, yeah. When it's so bad that they can't subsist without opiates or benzodiazepines or things like that, we have to put them as an inpatient, so they're controlled what they get and what they don't get. But if it's not that bad, we can see them on a methadone clinic. Troy is one of the first areas in the area that doesn't have a real waiting list for methadone addiction. I mean, for heroin addicts.
Yeah. But it just, I know like CDPC, the psychiatric center, they have to be like almost like guarded in. Are these people guarded in, or?
Not really. I mean, it's voluntary. You know, they come, they want to be admitted. There's no guards or anything like that. And there's detox for a few days, and then they get sent up to rehab if they want to stay even 2 to 4 weeks longer.
It's really a shame. How did you get into this? I mean, it's...
You know, initially, there's a course that doctors have to take. It's an 8-hour course. And I saw it advertised like over 10 years ago. And I said, you know, a lot of people need this. I could really help people by getting this course. And I took the course, and almost immediately I was put to work.
It's just a shame, because I wanted to talk to you about that. How bad is the situation?
It's pretty bad. I mean, in New York State, there's been a little leveling off, a little lowering this year, but there's like 22,000, down from 20 addicts, not addicts, deaths per year in New York State from this.
20,000?
Yeah, and that's coming down. Hopefully it'll continue, but due to our efforts, it's come down from 22,000 last year.
So what is, like, for example, your effects? Like, how are you getting people off of this? Because they just say once you're a heroin addict,
No,
again.
I don't think that's true. I just met somebody today who 9 years addict, he kicked it, he was able to get off of it. This new drug we've been using, buprenorphine or Suboxone, it blocks opiate receptor sites, so you kind of fool the body into thinking it's getting the heroin so they don't have the cravings that they would otherwise. And we put them, even in my office, we start people, we induce them with the Suboxone, they get off the heroin. Then it's a matter of breaking habits, you know, like cigarette smoking. Once you have a habit of having a cup of coffee with a cigarette, you'll always go back to that unless you break the habit. It's not a physical addiction anymore.
That's very interesting. So this is a newer drug?
It's fairly new. I mean, it's been out 10 years or so, and there's something also called Zubsolv. You know, what happens in the drug companies is once the patent is off, other companies are free to make drugs, similar drugs, and Zubsolv is also another similar drug, just buprenorphine. It's called the chemical name that blocks addiction. In addition, methadone. There's methadone which has been used for years. You know, in England they have it as well. But there's always been a wait for the methadone places. But now I think New York State is making that more available.
What do you mean, because they don't have enough drugs? What's the wait for?
It's a lot of bureaucracy is involved, you know, with methadone. You can't just wake up one morning and say, well, I want to quit this habit and go on methadone. Usually there had been a waiting list to get into a methadone clinic. It has to be approved and things like that. You can't just give out methadone. Methadone is usually only given out in these facilities, not doctors' offices.
So a regular doctor just can't do what you're doing right from...
Not for the methadone. If he takes the 8-hour class, he could prescribe Suboxone or buprenorphine. But unfortunately, a lot of doctors don't take the course. You know,
because they don't want to?
Right, they don't want to because they don't want to deal with these kind of patients. I mean, they're not easy clientele, you know.
Well, why do you say they're not easy? Do they want to do that? So I was just really going to ask you over here. I mean, obviously, like you say, it's voluntary, but...
Right. Well, you know, a lot of times what happens, too, and they blame it on the orthopedics and people like that who treat pain, is they give them these pain pills of codeine. They get hooked on the codeine. They go back, and the orthopedic says, at this point, you shouldn't really be hooked anymore. I'm done with you. And they throw them out. And at that point, you know, they need something else. So methadone or Suboxone would take the place of that. There's a big waiting list, even in my practice. You know, I'm only allowed... First you were allowed 35 a year, then you were allowed 100 a year, now I'm allowed only 275 a year, which is plenty, you know, because I try to see other patients as well. I see urgent care and family practice as well. We've been there at the Four Corners for over 20 years.
It's a shame that, you know, that there's so many people, but You know, like I always say, one of 10 jobs, I visit prisoners, and they say 60% of the prisoners are there because either drugs or selling drugs or drug-related. They need the drugs, like you say, so they'll
Right.
get anything, and they'll rob anything and everybody
Right.
just to get a few dollars to get that drugs.
Mhm.
But is any court mandated? Because you were saying
There are
before,
some court
everything is
mandated.
voluntary.
Well, there are some court mandated, that's true. And, you know, I think it's getting worse that some of these people, they get on benzodiazepines like Valium or Xanax as well. Klonopin is another drug of
Because
abuse.
it's antidepressant. I mean, why
You
would...
know, there are
some-
benzos which people take for anxiety. But, you know, they get on them. Really, you shouldn't take anything like that once you have an opiate problem. You shouldn't take anything like that. But, you know, they take it on the streets, all on the streets. They sell it on the streets.
Even these legal drugs, or, I mean...
Yeah, those are legal drugs that some people need. If
And
used appropriately, they can help people, but if used inappropriately by people who have opiate problems, it's not good.
It's a bad
Bad
mixture
mix,
already.
bad
yeah.
mixture, right. You know, the FDA just took gabapentin or Neurontin off the market, which they said a lot of people were selling that too. And I don't know if it's true or not, but what happens is that a drug comes on the market, then doctors can use it for anything they want. So the gabapentin was initially developed as an anti-seizure medication, but doctors started using it for anxiety and depression and anything else. And I think, you know, most drugs have a placebo effect, like 25%. If I gave you an M&M and I said this will help your pain, 25% of people would say, yeah, it helps.
Mhm.
So that's what happened with gabapentin, so now the FDA is making that controlled as well. And Soma is another muscle relaxant, I don't know if you've ever heard of that one. That's used, you know, you spray in something, some people get good relief from that, but that's a drug of abuse. Adderall, you know, for ADHD, attention deficit hyperactivity disease. These are all drugs that, you know, people take for the wrong reasons and are being sold on our streets.
They give them a high, or what is it?
Yeah, the high, you know, a lot of
depression?
them potentiate the effects, let's say, of the opiates or the heroin or the methadone.
It's a shame, and there's so many people getting on them. That's why I say sometimes, I mean, people say there's always gonna be a few bad apples in the society, but
Hmm,
sometimes they're like
20,000.
regular people over here
Right,
that,
it cuts across
you
all
know, and then I see
socioeconomic-
them in prison, and
Right.
they had a pain, and then they took drugs, they
Yeah,
couldn't get
exactly. It's a
off, like I
common story,
say,
yeah.
and then they're selling it, and once they get you for selling, you know, you're
Oh,
gonna
yeah.
do some real time.
Yeah, it's a shame because it ruins lives, and not just affecting the person themselves, but their caregivers, their wives, their families. Like alcoholism, you know, we treat alcoholism as well.
You know, people, you know, I mean, that's an argument sometimes I always have, because one of the ideas that, again, in the New York State Assembly and Senate, legalizing marijuana, which is anyway, a few
Right.
states already have,
Right.
but it's a big issue here. And I'm against it, you know, because again, you see that, what do people need all these drugs for?
Right.
I mean, if there is real pain,
Right.
so no one's stopping a person from having pain, you know, I mean, pain relief. I mean, there's pain relief, there's enough normal medical procedures, we have to go to these.
Right, I mean, there's also enough evidence that opiates are just as good pain relievers as your NSAIDs, such as Motrin, Advil, Aleve, and Tylenol. I mean, you can take
Really?
Yeah, you can take Tylenol with Aleve or Motrin, provides just as much pain relief as codeine. There's
I
many
didn't know
studies that
this.
show that.
I never heard that, that's
Yeah.
interesting.
Huh.
So that's what, you know, people say to me, you know, well, they're in pain and they need their marijuana. I says, you know, there's enough legal drugs out there to,
Right.
why do you have to go to these things?
Right, you know, personally, I've had back issues too. I've had 4 surgeries.
Right.
And you reach a certain point where you find other alternative treatments, massage, homeopathic remedies perhaps, acupressure, things like that. They all help.
Yeah, I was gonna ask you about, like, because they say, I mean, now scientific studies, I mean, you're obviously up for it, I'm a rabbi and you're the doctor, but they say the marijuana or any drugs, you can only imagine is really harmful. I mean, it's harmful for anybody, but then for teenagers, their
Right.
brains are, you know, they're still developing.
Sure.
How young do you see people, I mean, coming in drugs?
Marijuana, I see people in high schools smoking marijuana all the time, yeah.
Really, it's terrible.
Yeah, I mean, it's a gateway drug, we call it, you know, because in our clinic, we don't use it at all. I mean, I never got into medical marijuana, but it's a terrible thing. I think, you know, the state can make money off of it now, so of course, they're trying to get in the
Yeah.
business too. But,
It's hard, because then once it becomes a little legal, then, like you say, there's always a black market for something or
right,
another.
right,
It becomes difficult over here.
right.
So people do get off of it, that's positive,
It is
because sometimes
possible
I've
for-
always heard it's almost impossible to get
No.
off of heroin.
No, people do kick the
Well,
habit.
that's good, that's a very positive idea
Right.
over here.
I think, they should get medical help, certainly, if they can't do it on their own. I mean, sometimes in prison, you go through the DTs and everything like that from alcohol, but now even the sheriff of Albany County is allowing them to bring prisoners into our clinic in Troy.
Really?
Yeah, and they get methadone, and it's a lot easier that way for them than going cold turkey with sugar. You have to have a lot of, maybe the old time movies, you saw somebody withdrawing from heroin in a prison cell, just sweats and need for sugar, and if you can make it through that, then you're on the other side, then you wouldn't go back to it. But that's a terrible way to detox.
Yeah, I know, if you met a few prisoners, they say it's black, that's all they say, it's the most terrible thing to go through it.
I believe it.
But they get through it.
Right.
Is there any, I mean, again, you think it's worse now? Again, you've been around for a
I
while.
think it's getting better. I think now the medical community is treating this as an addiction and as a disease, not just something that, some people get and some don't. And there's been new drugs coming down the road as well. I think in Colombia, they're doing studies on some sort of cocktail IV, which gets you off of these drugs too.
So slowly but surely, but do they need psychological help? Like
Oh,
you
right.
say, it's a habit of like a cigarette, it
Right.
just almost becomes a
Becomes a
habit,
habit.
whether it's a real physiological need.
Sure, yep. I mean, with cigarettes, let's say, if somebody smokes a pack a day, if you can get them down to 6 cigarettes a day, then it's no longer a physical addiction, it's more psychological. And they can break that by substituting maybe a different habit. I say put a pencil in your mouth, chew on a pencil. I remember my mother, may she rest in peace, she used to smoke, and she did that. She was able finally to quit by, they had fake cigarettes in those days and things like that.
Just that habit of putting something in your
Right.
mouth constantly.
Right. Oral
That's
gratification.
interesting. No, it's important over here. Now, I wanted to ask you, because of course we're on the Jewish View.
Right.
I mean, that usually people would say, I remember a good number of years ago, oh, Jews aren't the alcoholics.
Right.
It's not a need for the Jewish community or to spend money for Jewish people. But now I think there is. I mean, there was an educational region recently sponsored by the Jewish Federation about the opioid crisis. So I'm just glad that, because then people come to us, as rabbis and talking about clergymen, I have a problem and where can I go? And say, well, there's nothing Jewish. That they won't legitimize your problem because
Right.
Jews are not supposed to have those problems.
But they do. I mean, it cuts across all socioeconomic fields. And I see Jews in the office as well as in the hospital. And we're only 1% of the population, so 1 out of 100 you will see Jewish people as well.
Yeah, well, it's not more or less, something like that. It's
Maybe a little
usually-
less. And
It's
I
hard
think
to
in all
say.
the time I've been at Conifer Park, I've only maybe seen a couple. But, they recognize me because I wear a kippah.
Yeah.
Shalom,
Yeah,
Rabbi.
yeah.
Shalom. I'm not a rabbi, but.
Yeah. Well, I mean, we're in the capital district in New York City, but again, it could be numbers. I mean,
Sure.
1% of a small number is smaller than a 1% of a
Right.
bigger population, obviously. But there could be a problem then. They say that becoming a problem
Right.
even in.
Isn't there Rabbi Swirsky, who's a doctor as well, has written books about that?
Yeah.
I used to think when I was growing up that, because we made Kiddush on Friday night, we had a little wine, but maybe not. Maybe not the case.
Well, sometimes maybe, you're right. The Jews weren't the alcoholics. That was the thing, you make a little l'chaim or
Right.
something. But now they say alcoholism is, like permeated the Jewish community and these
Right.
drugs, and it's out there,
Right.
marijuana becomes, I
Legal.
mean, I just can't stand it. I mean, I don't use it for sure, but I don't want anybody using it because I think it's an escape drug, I
Right.
mean, there's, deal with the issues. Everybody has issues in their life and everybody has problems, but there's legitimate ways to deal with it,
Right.
and
Yeah,
thorough
we-
ways.
Right, we insist upon counseling and psychiatric care in all those facilities as well, and that we have psychologists, psychiatrists who help us.
In the long run, though, is there, because, like I say, getting off of the heroin drugs, is there people come back to it? I mean, I'm sure there's never 100%.
Right, there is a recidivism rate, but there are a lot of people who can either kick it with drug help, other drugs. Some people don't like that a drug for a drug, but these other drugs, allow you to be a productive member of society. Whereas heroin, what's going to happen with heroin?
But they were on it for the rest of their lives?
Some
pretty
are. I
much?
have people who've been taking it for 20 years and they refuse to get off of it because their lives are so turned around, so different, that they refuse to get off of it. But the Suboxone, Zubzol, these other drugs, they leave no really bad side effects. These people have no aggressiveness or they don't have to go through withdrawal, and I try to get them off of it too, because it is possible, but you still have to be highly motivated. Seems like nurses and doctors who are on these drugs can get off of them easier than other patients I've found.
What do you say?
Well, they're highly motivated. They really don't want to take these kind of drugs the rest of their lives, because any drug I think you take has bad side effects long term. They used to think methadone would affect your teeth, although nowadays they say no, it's not true. But it is possible.
It's encouraging because, I never, I know people it's even hard to stop cigarette smoking,
Yeah.
they just say it's so difficult. And
Right.
I know people do, but these are hard drugs. But I guess, again, from the Jewish point of view, a person has to, like you say, be motivated or maybe a higher authority, because
Right.
Rabbi Twersky, who is probably the leading expert on at least the alcoholism, which in a way is a drug if you use it as a drug, but he'd always say that there's you have to have a higher authority, that idea of Alcohol Anonymous, that there's something higher
Right.
that's going to lift you up.
They're making even injectable drugs now that will help. There's something called Vivitrol, which helps with alcoholism and opiate addiction as well. And it's a shot that you get once a month. You come in every month to the doctor's office, you get a shot, and you have no cravings then. As well as Sublocade is another injectable form of Suboxone that you can come into the doctor's office and get a shot once a month. So you don't have to take a pill every day.
That's interesting.
Right.
And you don't feel high, though? It's not like a lesser high compared to the...
No, as far as I know.
Really? It's interesting.
I've never tried it personally, but I don't believe so.
It's just that they go through a normal life just...
Right.
But it's very good. I'm just glad that, because I see,
Right.
when you see from a rabbinical point of view or clergy that is ruining people's lives for
Sure.
really no reason. Again, people have physical problems and, they're born with it, you have to deal with it. But here it's like man-made, self-made.
Right.
You feel that there's genetics involved?
Definitely.
People say
why-
my father was an alcoholic
Yeah.
and...
Yeah, definitely. Why would somebody take pain pills for a while and be able to stop it, and somebody else not? Because I think there is genetics involved. And we always ask that, the family medical history. Anybody else in your family have problems with drugs or alcohol abuse? And a lot of times you will find that connection.
Yeah, well, that's probably a leading idea also. They're working with the genetics. And
Right.
trying to find out the cure or something, some chromosome somewhere, the magic bullet.
Yeah, medicine is really advancing and by leaps and bounds. And
Yeah, it's
hopefully
good to hear.
someday
Well,
we'll-
I'm just very encouraged by listening to this, that there's so many things to do over here.
Mhm.
So, but you get new patients constantly, though?
Also, we have to turn them away even because there's too much that we can
Really?
handle. Yeah, because you're listed on a federal website that lists your name of all the doctors who have taken this course and can prescribe these drugs.
You're on the federal,
Right.
as a doctor.
So they'll call up and they'll want to come in, and it's not so easy to get an appointment, and they have to be regimented. They have to have drug testing all the time, some blood work, and they have to agree to all these things. They have to sign a contract which states I will not take these drugs. And we've monitored them.
They won't take heroin anymore,
Right.
once they get this medical.
Right, or opiates, yeah, things like that. And they have to sign like 3 pages of contracts of things they agree to. And you can't take Suboxone if you're pregnant, although there is Subutex, which you can because that has a blocker in it, naloxone or Narcan, that can cause possibly fetal damage. So you can't take that if you're pregnant. But there are alternatives. And there's a waiting list. One of my nurse practitioners, Hannah McCarthy, who just signed on, she went through the course. Now she can have 35 per year. Next year, 100. Then after that, hopefully 275 under my supervision. So we're trying to make more spaces, but it's very taxing also. Like I said, this population is because some of people
Why
are
do you
always trying
say
to get
that?
on-
Why?
Well, some people are always trying to beat the system. That even though they're on these drugs, if they time it right, maybe they could come up with a negative urine drug screen. And people still, once they have the taste for the heroin, I think it never goes away.
It's I know, again, dealing with, I just want to remember in prison that an alcoholic, and I says, no, all right, you're a recovering alcoholic, how long has you been recovering? And he said, $6,783,
Right.
I thought it was like a joke, you just threw out a number. He says, no, every day is a
Right.
struggle, and I mark it down.
Right. And there's
You know.
again the genetics. Why can you have a l'chaim and he not? Because there are some people who one is too much. Just one they go all the way. Other people, and I think the what's the program that they have for alcoholics?
Alcoholics Anonymous.
Alcoholics
AA.
Anonymous. I think they do a very good job, and they have a higher power that they say people should subscribe to, and also they have, I think, a 12-step program where you're supposed to apologize to anybody in your life that you think you hurt or something like that in the past. And I've looked it over. It's a very nice program.
It's effective.
It's effective. Yeah,
It's
follow
a
it.
story that Rabbi Twersky, I call him Rabbi, he is a rabbi, but Dr. Twersky, he came to Schenectady locally here a number of years ago, and he was just talking, even though I thought maybe a little rabbinic, but he was
Right.
talking, he has many books on Judaic subjects for sure, very interesting, but this was totally alcoholic, just being a doctor. And I'll tell you even a cuter story. So they said, this is a special session, it was like a whole few days, for professionals.
Right.
So again, like you say, I want to be trained, I have to deal with it, and
Sure.
if there's some training, I'm open to being trained. So I called them up and I says, well, I want to join that, for professionals. And the lady on the other end starts laughing her head off at me. So I says, well, I know I'm not a doctor, I'm a rabbi. I thought she was
Doctor of
maybe what
theology,
kind of, yeah, but, oh, Rabbi, she says, I'm not laughing at you. She says, it's not to train professionals, it's for professionals that are alcoholics. I thought it was, they said for professionals, like you
Right.
say, people are,
Yeah.
doctors, nurses, people that are professional that have it. But I remember he said, well, like you saying it, which is proper of the protocol of the Alcohol Anonymous, which is a higher authority. So then he afterwards his talk, and we brought a few guys there, and we were talking to him. Then he came around and we talked to him personally. I says, I have a question, and I said, it's very nice that you say someone who has a higher authority, but a lot of people say, I'm atheist, I don't believe in God. So now what do you do if your whole program is based on a higher authority? So he's a shorter guy. I'm 6 foot tall, but he's shorter than me. But I don't know, some people, they're shorter than me physically, but they're looking down on you. I don't know, like that. He's a bigger stature than I am, to say the least. And he says, when I tell someone that someone says they don't believe in God, he says, no, what? He says, oh, you do believe in God, but you think it's you over here.
Right.
So, I just, that was
There's no atheists in a foxhole, right?
Yeah, no. Well, someone that hits bottom, but they have to realize
Right.
it's a hard always thing also, again, as Rabbi, you have to tell them you do need help. And
Right.
some people just, no, things will be all right, or they, some way or another, justify their behavior. Or, again, maybe like you say, they have to voluntarily say, get off of it.
Must be something psychologically wrong. Most heroin addicts inject it.
Really?
Some will sniff it, but if you put a needle in your arm to inject the drug, there's got to be something wrong.
Like it's very pronounced over here, putting a needle in.
Right. And
there's a need though. There's such a, I guess, like you say, I don't take it either, but you can
once
only
you take it,
imagine.
they say it's amazing that you get such a profound experience and insights, or nothing bothers you, or I don't know. Just stay away from it, everybody.
Yeah, that's it. Yeah, it's always the biggest thing. That just, so I say with kids, with their drugs, if you
Right.
stay away, you don't know what you're maybe missing. I don't know, that kind of euphoria, and
Right.
this way you'll never go for it. But
I
once
think I
you,
heard Mendel Rubin once give a talk, or somebody he brought to the Shabbos house gave a talk about addictions and how it's a religious experience for these people even to get high like that. But that's not what we're intended to do down here.
or on the other hand, like I say, exchange it for a Judaic, learn
Right.
Chassidus, as we would say, mystical ideas, and
Right.
enjoy that. Maybe that's why Alcohol Anonymous, just a God, there's something higher.
Right.
There is a kind of a high, so to speak. It is, praying and knowing God and
Mhm.
connecting to something more spiritual for us. So that is an important point over here. That, well, it's important that you're dealing with these people over here. I give kudos because, again, you can have a practice without this.
Right.
There's a number of times, like say a waiting list, is that because of your numbers? Because like you said, you're limited.
Right, by the number of patients the state will allow you to have. I think eventually more and more doctors will get involved, and more patients will be allowed to these doctors, and I think eventually there'll be more opportunities for people to get involved with this.
Is government paying for this, or is insurance?
Insurance companies are definitely paying for it. All of them do. They have to, because, if you have the insurance, they have to give some sort of help for this. I mean, they may not cover Suboxone, they may cover Zubzol instead, but they're similar drugs. Or they may not cover this or that. That's what all these insurance companies do. They try to make out the best deal with these companies to get the cheapest price, and then they offer that, and then they can switch it when they get other deals. So. But they all do have to cover something to that effect.
That's interesting. So it's good that, it's good, and it's, I think just for our viewers also, that there is help out there. Because a little bit, I was also thinking that you never would, you're on drugs, forget it. But saying, hey, there's, you can tell, for the people on drugs, they should surely try to think to get them, wean themselves off of it. But even obviously, it affects, like you said before, the family members, or even people at work. Something's wrong with you, why you're losing your job.
Right. Well, that's usually the last straw, is they lose their jobs. That's really? Like a lot of people reach bottom. That's the last thing that happens.
Because they can't function.
They can't function at their job, or they miss too much and they get fired, or whatever. Usually, I think that's the last straw, the straw that breaks the camel's back, or the thing that brings them to rock bottom, is they lose their job.
They feel, this way they can justify that, again, that everything's all right, I have money and everything is all right.
Right.
It costs a lot for out in the street, because again, like I've interviewed many sheriffs, and the problem is, he says that heroin goes for $5-7. It's cheaper than even a medical copay.
I mean, also the opiates are expensive a little bit. But yeah, I mean, there's everything out there, and the dealers, I think there's so many dealers, so much drugs on the street. I heard from one police officer, we don't even go after them anymore because there's so many of them. But, in the beginning, maybe they give them, here, try this, for free, and then once you're hooked,
They get you.
yeah, it's $5-7 a bag. And people do, like, they call it one bag, 10, and then there's a bundle, 10 bundles. People do like 40 bags a day, four
Really?
bundles a day.
Why, how long does it last?
It's not it's not like 24 hours. It's kind of, probably 6 to 8 hours in effect. So people are constantly shooting up throughout the day.
It's terrible.
Right.
I feel
And once
bad.
you have a habit for that, it's a bad thing, very bad thing.
So, I can only estimate how many people are still out there. You have so many, you're overloaded with patients, but there's so many people that,
That need help and that aren't getting it,
it's a shame. I mean, they was the police officers, the man in the street, you're right. I, again, interviewed the sheriffs and says, you want me to pick up heroin addicts? Because you say it's illegal drug. Legally, in the court system, they could really, hey, you have heroin on you. That's an offense, and I could lock you up. He says, I could fill up my jail overnight, he said.
Right.
But what's it gonna help over here?
Well, now that they're getting some help through methadone clinics, I think it will help a little bit, sure.
A little bit, yeah.
We are seeing a decline in New York State on the number of deaths per year. Hopefully that'll continue.
Because people are trying to wean themselves off of it.
Right.
It's important. All right, so, we're almost out of time, just a few more seconds to go, but I want to thank Dr. Michael Fuhrman, really, because like you say, you could have your regular practice, which you do anyway, and be loaded with that's enough, but here it's a double service to the community, because these people are, like you say, a person has a broken leg, obviously they need help, but these people that are drug addicts probably need more help than a regular person that has any disease or, any little things broken with them. So it's an important thing, and it's and again, for the Jewish view, unfortunately, I see the Jewish people, and there, thank God, not that many, but still, one is too many, that ruins people's lives, and I think it's a tremendous service to the community. So thank you very much, Dr. Michael Fuhrman. Thank you, and hopefully we get cured and everybody is healthy.
Amen.